Hey guys, welcome back to my channel, The ENT Resident. Today I'll be discussing a very short question, rather a Viva question that you get asked when you get a case of atticoantral disease in your practical exams. And that is the TOS classification of pars flaccida retraction. So first let's look at what a normal tympanic membrane looks like and how will you represent it in the form of a drawing. If you see in the first image over here, this is what a normal tympanic membrane looks like. This is of the left side. And you can see that there is a light reflex over here in the anterior inferior quadrant. You can see the handle of the malleus, and this is how normally it should look like. And this is how you'll represent it if you had to draw a schematic diagram of it. This is the scutum. This is the normal position of the tympanic membrane, and this is the neck of the malleus. Now, TOS classification has 4 stages. Now, the first stage is when there is a slight dimpling in the pars flaccida. So, there is a minimal retraction over here, but it is not touching the malleus at all over here. So, if you see in the image that I have drawn over here, that the tympanic membrane is slightly retracted, but however, it is not in contact with the neck of the malleus. This is how you'll represent it. And the left side image over here is showing exactly that, a endoscopic picture of it. Next, coming to second stage. In second stage, the pars flaccida is again retracted, but here it is different in the sense that it is adherent to the neck of the malleus. And however, even though it is adherent to the neck of the malleus, you're able to see the full extent of the retraction. So this is how you'll draw it. This is the neck of the malleus, and the tympanic membrane is completely adherent to it. And you're able to see the whole retraction when you're examining the patient. And the otoendoscopic picture is right over here. You can see that the neck of the malleus over here, you can see how it is retracted, the pars flaccida, and it is adherent to the neck of the malleus. Next, coming to stage 3, here what happens is the part of the retraction is out of view. So you're not able to completely see the full extent of retraction. And along with that, there will be a partial erosion of the bony attic wall or the scutum. So if you see in all the previous images over here, if you see that the scutum is very sharp pointed edge of a bone. But in stage 3 over here, you'll see that there has been a slight erosion over here. And this is the otoendoscopic picture. That's how you'll represent it. Coming to the last stage, which is stage 4, here what happens is, in addition to all the above changes that I have just mentioned, there is a severe erosion of the outer attic wall or the scutum. You can see that the scutum over here, how eroded it is. There is a definite severe erosion of it that you can note, and it is completely adherent, and you're also not able to see the full extent of the retraction. And this is what an endoscopic picture will look like. So these are the 4 stages of TOS classification of pars flaccida retraction. I'll also talk about the SAIDS classification of pars tensa in my next video.